One of your fellow advisors, Rob, told me to ask you that if you've ever injured yourself at a My Chemical Romance concert.
Yes. Well, thank you, Rob, for the wonderful flashback. Indeed, I was too happy in between our warm-up set and to when My Chemical Romance was about to take stage, galloping across the Panther Stadium, and your girl ate it. I got too excited for Gerard Way. Hey there, my name is Andrea Smith. I'm one of the undergraduate advisors within the College of Public Health and Health Professions. I see first and second communication sciences and disorder students, first, second, and third health science and public health students.
I will say I did have help from the advising team on these.
Okay, perfect.
So you might hear some familiar questions.
They gave me no warning, and I didn't ask either.
What's your favorite band?
Depends on the era. First ever band was Fall Out Boy.
Nice.
First concert I attended, so we'll give them the #1 spot.
If you had to live in one TV show universe forever, what would that be?
I'm stuck on a Vampire Diaries rewatch currently, so we'll go TVD.
What are some hidden gems on campus that students often overlook?
Food-wise, Ariando Room in the Rights Union. You can see almost into the stadium. That's a good spot for decent lunch and true reflection. Meditation rooms in the Rights Union also deserve a #2 spot there. And then I'd say our creek area. If you haven't even come to the HPMP building yet, this is a really undiscovered spot. I'd say those are some of my favorite spots on campus and not as utilized.
Can you talk about your journey so far and how you became an advisor?
I was a student here, and in my student experience, I saw a lot of the pros and cons for how current advising and just student interactions were rolling. I first got introduced to the staff side as a program assistant in the biology office. I could see in our advising space the most positive change, the most immediate change, and PHHP luckily had an opening. It's been a great 5 years so far as an official advisor. Advising was that natural role between not being in a class setting, but more so having that one-on-one mentorship time with students.
So the class of 2029 is starting soon. What's the best advice for their first week?
First week, have fun and absorb your surroundings. If you can just walk to your classes that first day before, or right before your first class, make sure you get your bearings as much as you can, but just go sit in Turlington. Take a moment to look at a club that you've never heard about. Speak with somebody who is either the opposite of you, the same as you. Try not to overwhelm yourself that first week. It goes by way too quickly. Know that you're here. You've made it to this great, next educational step, and rest assured you do belong.
All right, if you could describe your advising style in 3 words, what would they be?
We'll throw holistic in there. Second word, adaptive. Every session is different with a student. Every student has different needs. And third, we'll go with fun. Try to make anybody laugh. My first dream was an SNL writer, so I like to bring in improv-based comedy when I can.
What's the funniest or most unexpected question a student has asked you?
I've got a funny advising moment I could share.
Yeah.
In a group advising session, one of our transfer students, they took it upon themselves to give us a little show and dropped into a split when asking about, one of their special skills. So good demonstration.
Was it a front or a side split?
It was, front split, yeah.
Wow.
Yeah, so impressive.
Why would you recommend a PHHP undergraduate major to pre-health students?
So pre-health is a unique, you have to complete all of the sciences. Sometimes that's 20 plus credit hours. PHHP, in terms of my book, is one of the best ways to evaluate if you're in the right industry and truly wanting to get just a broader healthcare approach. See what the trends are, what the current challenges are, what we can do to help. So it's a good way just to evaluate you're in the right zone.
What advice would you like to share with your students?
Be true to yourself. That is the most authentic way to live your life if you are honoring and can reflect on what you actually want. We see as advisors a lot of students thinking they want to go to med school because of a outside influence. Make sure it's something that is reflective of both your current wishes and what you want your bigger life to look like.
Great words to leave on. Well, thank you, Andrea.
Yeah, thank you, Lindsay. Good luck.